Hi, my name is Dr. Matt. I'm the avian vet here at the Melbourne Bird Veterinary Clinic. And today I'd like to talk to you about the importance of doing a new bird check and what that entails. If ever you buy a new bird, whether you're adding to your collection or whether it's a sole bird that's going to enter your family and become a family member, it's very important soon after purchase, no matter where you purchase it from, to do a complete health check with your avian vet. The avian vet is likely to ask you to do a number of health tests associated with the clinical examination. Birds have a natural instinct to hide any sickness or hide any disease, so it's quite common for them to carry diseases that you may not be aware of. So therefore, doing health checks along with testing, might be blood tests, fecal tests and other types of testing, is extremely important when you're getting to know the things that your new bird may have and may be carrying. So common tests that we do is fecal checks, and we're looking for parasites that your bird may have been purchased with. So whether they have been wormed or not, it is important to double check that they aren't carrying parasites. There's many different types of parasites. Some worming treatments won't cover them all, and sometimes a lot of people will just worm by putting worming medication in the water. If the bird doesn't like the worming medication, they might not be medicated properly and efficiently. Other tests that we commonly do are tests for things like silicosis. Silicosis is an important disease, may be referred to as parrot fever or ornithosis. This is a disease that can cause mild sickness in parrots right through to sudden death. You can get respiratory disease or gastrointestinal disease with this. The other really important thing about silicosis is the disease can be serious in humans, so it's one of those diseases that we as people can catch from our parrots. And some people have actually died from that disease, so it's very important to have a screening of that particular disease when you first purchase your bird. The other sorts of diseases that are important to screen may be for beak and feather disease, polyomavirus, maybe even herpes virus. The sorts of screening you might do with your bird may depend on where you live and how common those diseases are. So sometimes we see with these sorts of parrots, we more commonly might be testing for something like polyomavirus as opposed to, say, beak and feather disease. Although they can get beak and feather disease, we don't commonly see it. So if we've got a budget to work for, and if we've got no clinical signs suggesting that, then we may decide to take the risk, and it may be a very low risk not to do those sorts of diseases. So it does help to know a little bit about the bird, a little bit about the sort of diseases you see in your area, and what your bird may or may not have been exposed to, particularly if you're working to a budget. If you're not working to a budget, sometimes just doing a full screening test of the full virus collection can be extremely useful. If you're not sure, doing a blood test, a general blood test, can also help detect underlying diseases. So it may not specifically detect for a specific disease like silicosis, but it may give you an idea whether it's worth going on to doing more extensive virus testing, particularly if you get changes in the white blood cell counts, which might suggest some kind of infection going on inside the bird, or changes, say, in liver or kidney tissue results. So all of these tests are extremely valuable and extremely important. It may mean that your first consult might be quite expensive, but in the long run you will end up with a bird where you know what is going on with that bird. You might discover disease early that you can treat and detect. You might find that the bird has a disease that can't be treated, and before you bring it into your flock, you can make a decision whether you actually return that bird and replace it. It's very, very easy to bond very, very, very quickly to these birds, and those decisions can be extremely hard to make, even if you've only had the bird for a week. So another reason to have in mind as soon as you purchase that this is a bird I need to purchase on the basis of a clean bill of health. It's not a healthy habit to allow your bird to chew between your teeth or to eat out of your mouth. There's all kinds of problems associated with that. It will lead to behavioural problems because that's a very sexual kind of thing for the bird to do. But it's also unhealthy. The sorts of bacteria and things we have in our mouth may lead to sickness with our birds. So they can develop sort of throat and sinus infections, or they might develop diarrhea and gastrointestinal problems as a result. So it's very important for us to be hygienic with our birds and to also understand those behaviours. Now, the bird might be doing that because it's trying to tell you that it loves you, and it's trying to mate with you and develop that kind of bond. So important not to do those sorts of behaviours and understand why the bird is trying to do those behaviours with you, but not encouraging those behaviours. There are some viruses and things which some species of birds are actually more prone to than others, and the viruses may cause more disease in one bird than another. Beak and feather disease is a very common one that we see in parrots, but especially Australian cockatoo species. So species like this sulphur-crested cockatoo, beak and feather disease may be a very important screening test to do, particularly if you've just purchased a cockatoo. That'll be right at the top of my list, even if I can't see any symptoms or signs of the disease on the bird. It's important to recognise that there is a difference between having the virus and actually having the disease. So some species of birds will actually carry the virus without getting sick or without showing signs of disease. So these are birds that you don't want around cockatoo species, particularly young cockatoo species, because if you've got a young cockatoo, their immune system is not strong enough to handle the virus, and that's when they develop the disease. And that's when their feathers become all abnormal, they get beak changes and beak problems, and this can be a lifelong thing for these birds. Once you develop those changes, generally they don't recover from those changes. But you can have a bird that may be positive for the virus and never develop the disease. And the typical example or common example is lovebirds. Lovebirds will carry this virus but not actually get sick from it. So you never really want to be breeding lovebirds anywhere near cockatoo species. Because your cockatoo species are the other way around. They, particularly young birds, they will get the virus and get the disease. Older birds may get the virus and not develop the disease, and we never know without doing screening. So if you have a young cockatoo and you purchase another cockatoo that has the disease or is having or may have the disease, doing a screening test before you mix them and having a very good quarantine procedure is really vital. Otherwise you'll have two cockatoo species that will end up with the virus and the disease that can't be cured. And this will definitely shorten their lifespan. Over the years we've certainly can manage birds that have the virus, but they will always have the virus. It's kind of like people with herpes virus. When they're stressed, they'll come out with cold sores and things. With beak and feather disease, they carry this virus and it will come in waves. So they will always have the feather problems and feather and beak problems that may need regular trimming and regular care. But they'll have periods where they're quite sick with the virus and periods where they seem to be better with the virus. And that may depend on stresses, may depend on diet, may depend on a lot of different things. I have cockatoos that have beak and feather disease where they're a sole bird and they're part of the flock, and the family have been happy to manage these birds in their home. And because they treat them so well, give them high quality nutrition, these birds have actually lived for a lot longer than we used to see them live. So I've got one that's now 10 years old that is doing very, very well. We used to see these guys only living for a year or so.
That's sad. In the wild it's the same or even less? They just drop off.
They come in.
Yeah, that's horrible.
And they can't, and they get cold and stuff as well. Beak and feather disease can sometimes be difficult to recognise at the early stages. So with a cockatoo, it might not even show up for a year after you've purchased it. Some birds will get it so severely as young birds that they will die very quickly, and some birds will have the slow insidious disease, which needs to be managed if you want to keep a bird in that condition and think that you can provide it with a quality of life that's worthwhile. The early signs of the disease, particularly cockatoo species, is their powder down is affected. Because that feather is cycled so quickly and they come out very quickly, they grow very quickly as well. That's the first feather that will be seen as being affected. So these feathers stop growing and don't grow properly, and the bird will no longer be producing this powder. So when you touch them, you don't get any powder on their hands, and you might see a really shiny beak because they have this grey looking beak simply because when they're grooming, they're getting this powder down coating their beak. And if they're black and shiny, that will be a telltale sign that something's not going right with their powder down. You might also get a bird that's very, very dirty, because the whole idea of this chalky powder down is as it breaks up and comes off the bird, it takes all the dirt with them, so it helps them keep clean. So these are not a bird that do a lot of bathing. It's their powder down that helps them keep clean and fresh.
You guys want to come down? It's all over. Oh, I can't reach.
Let's move the cage up higher, that'll move it a more. Oh, gotcha. Yay!
Hi. Dave, come down with the dinghy. There we go. Good job, team.